My name is Sohrab Virk and I'm an orthopedic spine surgeon at HSS. I see patients of all ages that are dealing with spinal pathology causing neck pain, back pain, arm or leg pain. In some instances, the patients have weakness or neuropathic pain that I'm trying to treat. I think it's really important for the first visit for me as a clinician to listen, to hear what the patient's pain complaints are. No one wants to come to see a spine surgeon, and it's really important for me to understand what their goals are and how I can help them. I think it's completely normal to be nervous about spine surgery. I think spine surgery should always be a last resort. And I think one of the things about spine surgery is that if you adhere to that principle of surgery as a last resort, patients understand when it's time to have surgery. And I think also your approach to surgery matters substantially. And I am a big believer in doing the smallest possible surgery to get patients to where they want to be. And I use that approach to make sure that the patient can get to where they want with the least amount of pain, the least amount of discomfort. And the surgeries that we're able to perform at HSS are really innovative, and they get people better with less trauma, with less pain. And I think that's one of the best things about working at HSS. Minimally invasive spine surgery, endoscopic spine surgery, is really the use of tools to limit the amount of soft tissue trauma that we do during surgery to be able to accomplish what we need to get accomplished during surgery done. That means taking pressure off nerve roots and stabilizing the spine. It is a really important tool for us to help patients get better quicker with less dysfunction and pain. Success for patients is super important to me. The phrase I use for my patients is that all their aches and pains are my aches and pains after surgery. So it's being able to see them get better in a timely fashion. It's a joy. It makes the job worth doing.